Good morning, good afternoon, good evening, wherever you are, and welcome to our IFSO webinar. And we're going to talk today about how to publish. And there's no one better to talk about this topic rather than Professor Scott Shikora, our editor-in-chief. Welcome, Dr. Shikora. We have panelists with us, Dr. Alan Saber from New Jersey, US. Dr. Ali Aminian from Cleveland Clinic, and Dr. Abdurrahman Numeri from Charlotte, North Carolina, USA. Welcome, everyone.
Thank you very much.
So, just one announcement. IFSO launched the first edition of the Journal for Video Case Reports, so please check that out. And please submit your video cases to be peer-reviewed and published, since we're talking about publications. But without further ado, let's hear Dr. Scott Shikora tell us on how to actually publish. Please, Dr. Shikora.
Thank you, Professor Bashir. It's a pleasure and an honor to be here. I'm very humbled that you considered me worthy. I've been fortunate enough to be the editor-in-chief of obesity surgery for the last almost 7 years. So I've been able to look at lots of papers that get accepted, some that get rejected, and I hope that this presentation will be helpful, particularly to the young investigators who for the first times are submitting papers and not sure why they're not getting accepted at a high rate. These are my disclosures. The only one that has any bearing on this presentation is, as we know, I'm the editor-in-chief of obesity surgery. So why do we publish? Publishing manuscripts is important as a vehicle for dispersing medical knowledge. If a colleague of ours is doing a procedure somewhere and getting special results that we hadn't seen before, that is how that procedure then gets into the mainstream, because it gets written about and published. Additionally, in the academic world, it's important for one's career to publish. So there's a twofold reason why publishing is very important. Now, I have to start off with this disclaimer. Not all submitted manuscripts get published. And the better the journal, the lower the percentage of those papers that get accepted. So you really have to do a good job in how you prepare your paper to give it the best shot to get presented. And that's what I hope most of this talk will cover. So the better the journal, the greater the rejection rate. If you look at a journal like New England Journal of Medicine, they probably accept 10% or so of all of the papers submitted, and the other 90% get rejected. Well, obesity surgery has been improving on a yearly basis, and I want to focus you on 2017 because it's the last year of full data. And as you can see, we had almost 1,000 submissions, and we ended up accepting 52%, and that's quite good, except if one of your papers happens to be in the 48% that got rejected. If you look at 2018, we don't have complete data yet, but we're projecting to be way over 1,000 submissions. And what that will mean is that we can even become more selective, getting the even better papers, which is good for the journal as far as its impact factor and its reputation. So what happens when you submit a paper? It's online. It's sort of this black box. The paper goes in, and then you get messages back from the journal. Well, the papers come to me first, and I can receive anywhere from 30 to 50 papers a week. I can't read in detail every little paper. So what I end up doing is skimming, reading the abstracts, looking the papers over briefly, and doing what's called the first cut. Those papers that are inappropriate or look very poor from the get-go, I may reject. But the rest of them then get sent from me to the associate editor. And the associate editor takes the paper and reviews it and then sends it out to reviewers. And it may be anywhere from 2 to 3 reviewers, and sometimes even more than that. And then the paper will go back and forth almost like a ping pong ball until a decision is made on the paper. And I want to show you the process. Now, I know this looks very confusing, but the papers start with me. If they're reasonable, I send them to the associate editor. If it's reasonable, the associate editor sends it to the reviewers. And then it may depend. It may right off the bat get rejected. It may get accepted. but often it'll go back into the queue. It'll go back to the authors for corrections and adding to it whatever the reviewers and the editors felt was necessary. And then it'll go back to the reviewers, and then it'll go back to the author, and so on and so forth, until the paper is either quality to be published or gets rejected because it'll never get there. So that's these lines here: reject, accept. So that's a process that's kind of complicated, but it actually works in the best interest of the journal and the authors. Because even if your paper is ultimately rejected, and we won't take it back, hopefully the comments made by the reviewers and the editors make it a better paper for when you submit it to the next journal. So what's the recipe for success? What are we looking for in the journal? We're looking for fresh, we're looking for new, we're looking for interesting material that's pertinent to the readership of our journal. So I'm very careful on what animal work I take, what plastic surgery papers I take, because I'm always putting myself into the situation that I'm like you, I'm a bariatric surgeon, and I'm looking for articles that are important to a bariatric surgeon, not to a plastic surgeon, an anesthesiologist, or a researcher. So we're looking for hot topics in bariatric surgery. The paper has to be well written. It has to be organized. And I understand we're an international organization. English is not the first language for many of our members, but the language of publication is English. And if the English grammar is poor, the paper will be sent back for more work, even if it means hiring a company to proofread the article and to put into better English. We're looking for good science and the proper use of statistics. If you don't know statistics well, as many of us don't, there are statisticians that can help you, some for no charge, some for a nominal charge. And I recommend that you use it, because otherwise your data may be flawed. And after all the work you put into the paper and you send it to the journal, it would be a shame to be rejected on the basis of bad statistics. And lastly, that the data of the study you're writing about supports the conclusion. It's kind of funny, but sometimes you'll see a paper where the data says there's no difference between, say, two interventions, but the conclusion written by the author is there was a difference. Well, that paper is obviously not going to get published. So you want to make sure that everything is consistent within your paper. Now, every journal has a number of different article types that they accept, and this is just from our journal, Obesity Surgery. Original contributions are most of our science papers, whether it's clinical or basic science. I'll talk more about all of these in a moment. Review articles. If you're looking to get the best shot at a publication, write a review article, because they're highly cited and therefore they're important for journals. So if you decide you want to write up the history of, let's say, non-alcoholic fatty liver disease, that's a paper that has a better chance in some cases of getting accepted than if you just looked at the last 200 lap bands you did or whatever. Now, case reports are accepted by some journals, but not by others. And Obesity Surgery is one of the journals that does not accept case reports. Why is that? The reputation of the journal and its status is based on what's called impact factor. The impact factor is a scoring system based on how often the papers within that journal get cited in other papers that are being written or have been written. Case reports don't get a lot of citations. So for a journal like Obesity Surgery, they're wasted space. You're better off writing a review article. But there are some journals that do accept case reports. Letters to the editor is a way to comment on a paper you read or something you know about. You can even send a little case report, I call it through the back door, as a letter to the editor, and they'll get published in most cases. And then, as you can see, there are some other categories that your paper may fit into, and that's the direction you would take if you're looking to get it published. So let's talk a little bit about the different types. The majority of the papers in the Journal of Obesity Surgery are called original contributions, and that's a grab bag that takes into account all of the research papers and all of the clinical papers. It's the lion's share of the submissions and the published articles, and you'll see if you open the table of contents, most of the papers are original contributions. They will be judged on their science, they will be judged on the grammar, the English language, etc. And if you look under the instructions to authors, which you need to really know well before you write your paper or before you submit a paper, there's a word limit to how long the articles need to be, and this one is 2,400 words. I mentioned review articles. They could be solicited, where the journal asks you because you have an expertise in an area, and the journal will contact you, one of the editors, and say, would you write us an article on the non-alcoholic liver disease, or would you write us an article on EROS in bariatric patients? And for the journal, that article is gold. We would love to have it. Then there's also self-submitted, where no one's asked you to write it, but you wrote an article because you wanted to write an article on a particular topic. And those are just as well accepted. Now, review paper needs to be scholarly. You need to review the written literature on the topic. You need to have it well referenced. And you need to write it as if you were writing an article for any newspaper. There has to be a beginning, a middle, and an end. It needs to be well researched. You don't want to leave out any major breakthroughs in the field or anything recent that's come up, a new operation or a new finding. You need to include that. So you really do need to do your homework and research these well. Now, you can include personal opinions and experiences, but you have to state that that's what they are, so they can be differentiated from fact that you can reference. And the review articles are about 3,000 words. Now, if you submit a review article or any article and you're a little bit over the limit, don't worry about that. I'm not going to reject your article because it's 3,001 words. But if we're looking for a limit of 3,000 words, because there's a limit to how much we can publish in a particular issue, don't send one in that's 8,000 words. New concepts. This would cover new devices, technologies, procedures, anything that's new, hot, even if it's not really well developed yet. It's just starting. You've done a little feasibility trial. You did your first in-man safety trial. You did a little animal work on something that's totally new and interesting. We'd love to see it. And that's a short article of about 2,400 words that describes this new procedure. Now, if it's something that you can give a detailed description of the procedure or the treatment, then please do, so the reader can get a sense of what you were doing. Brief communications. This would be sort of a mini article, and they're usually very short. It may be a snapshot look at a particular time period in the middle of a much larger trial, or a very small case series that is important and straightforward, but it's not really mature yet for an original contribution. You could send in a little case report like this, case report's not a good word, a brief communication. Now, you need, again, and I can't say this enough, to look at the instructions for the authors before you write your paper. And I've also handed in for this webinar the actual instructions off the website, but they're on the website. Most papers will ask for an abstract, and then an introduction, materials and methods, results, conclusions, then your references, then your figures and tables. The abstract is the catch. This is where either we're going to read your paper and send it on for potential publication, but also the reader is going to thumb through the journal pages and look, and they're only going to read the articles where the abstract grabs them. This is what happens with newspapers when they write the tagline, the title of the article. They do it in such a way, the words they use are carefully selected to grab the reader. And that's what's going to happen with this abstract, because otherwise this may be a wonderful paper, but if the abstract isn't fresh and grabbing, it may never make it to publication. It should be succinct and organized. Once again, you need to wordsmith this to make it as interesting as possible. And often you need to answer these questions, not formally, but in your own mind and how you design it. Does the abstract look sound? Does the data look sound? Is it well written? Is the topic appropriate for obesity surgery or the journal you're submitting it to? And again, if this is an article on tummy tucks and it has an importance to a bariatric surgeon, I'll let it go through. But if it's talking about tummy tucks where only a plastic surgeon would get any value out of it, we probably won't publish it. We don't have the room. Now, there are structured abstracts and unstructured abstracts. And once again, you just have to look at the instructions of the authors. Obesity surgery generally will have a structured abstracts, which means they also have a format, a background, which is an introduction, the methods, the results, the conclusions. And they should be less than 250 words. And once again, we're not really strict if it's a little bit over, but it has to be within the range of the 250 words. Some journals will also ask for additional topics such as objectives and settings, but obesity surgery does not. Now, there's also types of articles that don't require a structured abstract. So obesity surgery will allow you to submit a brief little just intro for review articles, for communications. These are very brief, and they're basically one paragraph, and all they basically say is, for instance, there's a growing body of literature on non-alcoholic fatty liver disease. This review article will review the latest material on it. Done. That's your abstract. So quite simple. Now let's get into the meat of the paper, the introduction. This is where the article is getting set up for the reader. Why was the study even done? What's the reason for it? What was the interest? What were the goals of the study? What were you hoping to accomplish with it? Did you accomplish it? And you should include the results of previous investigations, if any. For instance, if you're doing liver biopsies for non-alcoholic fatty liver disease, go back in the literature and see what previous articles, if any, were talking about that disease and also about liver biopsies. The introduction should be brief. It should not be a lengthy review of the medical literature. It should only be a setup. You're doing this study for the following reasons. Previous studies have supported your conclusion, or previous studies have had different results, and that's why you're doing this study, because you're looking at it from a little bit different angle. That's all you need for the introduction. The methods need to be clear. They need to describe how the study was performed. They need to include the statistics. And basically what you're doing here is enabling another reader or investigator to reproduce your study exactly like you did it based on the recipe that you used. Therefore, the methods must be able to adequately test the hypothesis, and that's for the reader as well as the author. The study population has to be adequately powered. There's nothing worse than having a study, a beautiful study, great research. You're looking at two variables. You find out there's no statistically significant difference between these variables, but it turned out the N was too small and it wasn't adequately powered. Had you had more patients, you might have found a big difference. And that's important because that then basically completely changes the message. So that's where a statistician or a mentor, someone who's written many papers before, can be helpful. And also patient follow-up is very important. If it's too short a follow-up, it often will make the data unreasonable. Then the results. The results are where you present what your findings were. We did liver biopsies on 200 consecutive sleeve patients with fatty liver disease, and this is what we found. Boom. That's it. If the reviewer can't understand the results, the way it's being presented, that paper probably will not get further along. Tables, graphs, and figures should highlight or organize the data, not duplicate it. So if you have a lengthy paragraph explaining your data, you don't need a table or a figure. But if the table or the figure show the data clearly and organized better than what you could say in a paragraph, you don't need it in the paragraph. You could just basically say, see figure 1 or see table 1. On the other hand, you can't have too many figures or too many tables. Once again, it clogs everything up and it takes away from the actual paper. Now, one other thing, the results section is not where you put your thinking or your conclusion or your summary or your interpretation of the data. It's only to report the data. Any interpretation you may need to make as to why you found what you did, that goes into the next section, which is the conclusion section or the discussion. That's where you say, we did liver biopsies on 200 consecutive sleeve patients with fatty liver disease, and we found that in most cases after surgery, the liver gets better. Great. Now you could say why. We think the reason the liver gets better is the following. That's this section. You should explain unexpected outcomes. Why did you find something you didn't expect? As best as you know that. You may not know why, but you should say that's a possibility of why we think our data was different than what we anticipated. You should comment on the limitations of the study. Every study has limitations. The limitation of this study, it was retrospective, the follow-up was not as good as we liked, et cetera, et cetera. And this is where you also put a bit more of the review of the literature. And you want to include articles that support your data. They did it the same way, they had similar results. Or if they had different results, and why do you think they had different results? This is your place. This is your painting to paint it any way you want to get the word out, what you think happened on your study. And once again, the references, you need to cite every statement of fact, such as the leak rate after sleeve gastrectomy is 1 to 3%. You need to quote a few papers that support that. The references should be as current as possible. They need to be an adequate number of references, but not overwhelming. You don't need to have hundreds of references after a paper. I can't tell you the exact number you need to have, but you need to have the important ones with your paper. And that's where you do a good literature search. And the references can be supportive or contradictory. It doesn't matter as long as they're relevant. Now, what happens? The paper comes to us. Let's say that it passed the first hurdle. It makes it to the reviewer. What happens at that point? Well, the reviewer may reject it and say, this paper's not very good. I don't think it could be repaired. It's not right for the journal. And then it'll come back, and that paper may get what's called an immediate rejection. If it's worthy of review, then it can be reviewed by the reviewers, and their suggestions go back to the editor, and the editor now has a choice. The paper's good enough as is to be accepted, and honestly, that's only a small number of papers. Most of them do need some revision. The paper is quite good, but needs a little bit of revision. Please add another reference. You used the wrong terminology over here, or explain to us how you only had 30% follow-up, something along those lines. Then another category is the paper needs a lot of work, but it's salvageable. So the reviewers and the editors will send back to the author a number of concerns or requests. Please do this, please change this, please add a reference, please tone down your conclusion. It's a little bit harsh, or your conclusion's too long. And the paper can then be reevaluated once it's corrected and sent back to the journal. And then lastly, as the immediate rejection, there's also another area where rejection, where the paper has gone for a couple of reviews, but the reviewers and the editors feel that the paper has not been improved. The authors have either not put the effort in to improve it, or it just won't improve, and those papers will not necessarily get another shot, and they may get rejected. And again, I think I covered this already, but the grounds for the paper not making it out of the editorial board would be that the content is of little or no interest to the readers. It's the wrong topics. The data is old and stale. It doesn't add anything new to the literature, or that the paper is just poorly written, disorganized, bad grammar, bad English. So let me give you a couple of examples of the types of papers that may not make it out of the editorial board. So here's a paper, 50 laparoscopic sleeve gastrectomies with 6 months follow-up, 1 leak. Conclusion, laparoscopic sleeve gastrectomy is safe and effective procedure. So why won't this paper get accepted? Well, there are papers now with thousands of sleeve gastrectomies. There's papers now with years of follow-up. So what's interesting or new about 50 patients with 6 months follow-up and in 1 leak, and then after 50 patients, we could say that the operation is safe and effective. So poor paper all around. It won't go anywhere. Another example, 150 lap gastric bypasses using the circular stapler for the GJ. That's okay. Then 500 consecutive patients followed where they used the linear stapler. They changed the stapler. 12-month follow-up. 3 leaks were noted in the circular, 3 leaks in the linear. Conclusion, the linear is superior technique than the circular. There's no basis here for that conclusion, because this is a consent. The study started with 150 and then it was another 500 patients. They're not randomized. This could be learning curve, just poor paper going nowhere. Lastly, group measures an obscure protein in a small number of rats versus obese rats, and the obese rats have a higher level of this obscure protein, and therefore the obscure protein may have a role in the development of obesity. Do you think anybody who is a bariatric surgeon or takes care of bariatric patients is going to find this paper useful or helpful or interesting? Probably not. So this is a paper that needs to be submitted to a physiology journal, and it gets immediate rejection. So to sort of summarize, why would reviewers not want a paper to get accepted? Once again, the substance is poor, the science is weak, the stats are bad, nothing new or novel to report, or that the paper is poorly written. Science is good, bad language, bad grammar, disorganized, illogical. If the reviewer can't understand the paper, the readers won't either. So if you want to look at our statistics in 2017, as I told you earlier, we had almost 1,000 submissions. This year, we're over this by a considerable amount. We immediately rejected 10%, and then we rejected about almost a total of half of what came in, all said and done. Now, Springer, the publisher of the journal, also has a mechanism where the papers that we don't accept, because our standards are fairly high, can be transferred to another Springer journal that may accept it. So they may offer you the opportunity to send it somewhere else if we decide we don't want it. And the journal response is, as I mentioned already a couple times, we could accept as is or add minimal changes, accept, but we are asking for a few changes, reject, but we're willing to reconsider once you make a revision, or reject, it's not worth reconsidering. And the only thing I want to add to this is that if the reviewers ask you to make some changes, make the changes, because otherwise, if you send it back without the changes, the paper is no different than it was before. It's not going to get published. Tips for improving success. I think the first bullet's the most important. If you're new to this, get a mentor, someone who's senior, someone who's written papers before. Have them look over the project before you write the manuscript. Have them review the manuscript with you thoroughly before you submit it to the journal. That'll save you a lot of wear and tear. And also, follow the journal's instructions. I can't say that enough. I still get every single week papers where I have to say, you didn't do the right structured abstract, your grammar's bad. Reasons to reject a paper have nothing to do with the science. Now, this is just a snippet from our instructions for authors. And what you can see here is that the weight loss must be expressed as change in BMI or percent total weight loss. What that's saying is it's not accepted just to put excess weight loss. As much as we all like excess weight loss, my brain works that way, you can include that in the paper, but you have to have either a change in the BMI or percent total weight loss, which is more consistent with the medical obesity community and what they write in their papers. And then another thing, the world has known the one anastomosis gastric bypass is the mini gastric bypass, MGB. However, the Executive Council of IFSO voted that the official name is one anastomosis gastric bypass. If you send the paper in calling it a mini gastric bypass, I will send it back to you because of this. You can, if you prefer, hyphenate the two, and I'll accept that, at least for the time being. But it's very important to follow the instructions. You can't make a political statement here because your paper is just going to be rejected. So please follow the guidelines that are on the website. Now, what to do if your paper is rejected? Understand that all of us, no matter how many papers we've written, we're not always perfect. Our papers are sometimes not worthy of publication, or they could be misunderstood by the reviewers. Read the reviewers' comments carefully and answer them and revise your manuscript accordingly. Now, don't argue with the reviewer. Reviewers are basically like you and me. They're just surgeons, they're psychologists, dietitians, nurses. They may not be an expert on your field. They may not be an expert in reviewing. So there are times they may be wrong. You can very politely say that the point you're asking me to change, I believe, is not the right change. I want to keep it the way it is for the following reasons. And I'm the final arbitrator of all this, and I think that's okay if you make the good point. But if the reviewer says change something, don't say, no, I'm not doing it. You're wrong, because that's not going to be helpful. And look, there are times where the journal will reject your paper. They'll not give you a chance to resubmit it, but use the advice from the reviewers, make your paper better, have your mentor look at it, and send it to another journal. If you keep that up, ultimately, most papers will find a journal to accept it. Now, just a few issues I want to talk about in the final few minutes, that if you're doing a research project, you have to know that to get it published, many countries have national research registries online that you have to register your study with. Understand also that everything must go through an IRB, must have an informed consent, and conflict of interest documents signed, and that's pretty standard. Ethics in publication. Every step of writing the paper, you must be ethical and honest, the same way you need to be with your research or with your patient care. Ethical behavior in writing is very important because this is what other people are going to take away from your paper. And if it's unethical, it's either going to be harmful to patients or it's going to just demonstrate that your character is not what it should be. And you could actually get into trouble with different medical regulatory organizations. There are many different types of unethical behavior, such as fraud, falsifying data, exaggerating data, selecting which data you want to include, and eliminating data that goes against your ability to publish the paper. Plagiarism, both natural plagiarism, where you're copying lines, sentences, paragraphs from somebody else, or even self-plagiarism. Believe it or not, if you copy your own stuff, that's plagiarism as well. Exaggerating data, falsifying data, selective reporting of the data so that you can make the points you want, even though the data doesn't support that, will ultimately harm you and harm your patients. And we can't go there. So all researchers should be ethical in their behavior. And by the way, if you do a research project and your data turns out to not support the conclusion that you had going into it, the question you were trying to answer, negative studies in many cases have more value than a positive study because you're showing something didn't work. So don't be hesitant to publish that. And obviously this is pretty much self-explanatory, that if you're using falsified data, you're hurting us as a Barrett community, you're hurting yourself. You could end up losing your license, you could lose your credentials to work at a hospital, you can lose your membership in medical societies, but you also can hurt patients. And I mentioned this briefly, that there is no difference between intentional plagiarism and inadvertent plagiarism, where you didn't realize that you were copying from somebody else. Now, how do we find out about plagiarism? Well, I don't know all of the papers that have ever been published in obesity surgery to read one and say, aha, that's been plagiarized. But the publisher, as many other journals do as well, have an instrument, a computer software program that compares every word of your paper, every table, method, idea, etc., figure, with what's in a huge literature database, and can come up with matches when you copy and paste out of some other work. And the one that's been used by Springer is called Authenticate. And how it's reduced plagiarism is it checks the manuscript word for word, line for line, against a massive library of what's already been published. And if there's a greater than 5% match, it sets off a little bit of a red flag, but a greater than 20% match requires an investigation. And I just want to point out, look here, the database includes 24 billion current and archived web pages, 122 million content items, 900 million published works from journals, and so on and so forth. So it's very hard to plagiarize a work and to go through the Authenticate and not get picked up. Now, duplicate publication. So you do a beautiful study on your non-alcoholic fatty liver disease. It's published. We're all happy with it. And you decide you want to publish it again. You can't do that. You can publish again on the same population, but it has to kind of be a different project. You can't just add 5 or 6 or 7 more patients and write it up again the same way. But if there's a message because it's another year of follow-up, that's okay. But you have to be very careful. Now, there is an exception to this. What if you are looking at a certain disease related to obesity and you find that in your country, You have now created the white page on that disease, how to treat it. And you feel that that's so significant, that word must get out into the community. Journals can agree to co-publish a paper like that, a guidelines, a white paper, a paper with extremely high impact, but it has to be acceptable to the different journals at the same time. So you could ask obesity surgery and then SORT and then maybe the surgical endoscopy to all publish it together, but we all have to understand that's what we're doing and it gets designated that way. And this is not something done very often. Most of the time, a paper gets published as a single paper. Co-authors. In the past, in the academic world, it was commonplace to include a lot of colleagues, particularly young colleagues, so they can get references, publications on their CV, even though they put no work into it. That no longer exists. Anybody included on your paper as a co-author has to have had some role in the paper's design. Excuse me. And that could be helping with writing the abstract, that could be helping with writing the actual protocol, the study design, how it was done, analyzing the data. Even just proofreading the manuscript and improving the grammar would qualify you to be a co-author. But you can't just put people down because you want to help them with giving them another publication if they have not participated in even a small way in getting that paper to publication. And conflict of interest, this is common throughout the academic world, that for the credibility of the published article, you need to report any relationship that any of the authors may have that could create a bias. Even if there's absolutely no bias there, you must at least report it and let the reader determine whether that's an issue. For instance, if I write an article on the VBlock device, which I was involved with as a researcher, then I have to say that I was a consultant to the company, I was the chief medical officer of the company, whatever my role was, and let the reader determine whether they think that role could have in any way, shape, or form biased the paper. More often than not, it wouldn't, but you need to have that disclosure. So, in conclusion, to summarize, creating a manuscript worthy of publication in a peer-reviewed journal is important to one's academic career. And I want to also say I think it's important to good patient care. This is how we all advance. We read articles about what our colleagues are doing, and then we try to do the same when it looks like it's a good result. The process is a process. It's not easy. It takes a lot of steps, but it's a worthy endeavor. Not all manuscripts are going to be accepted. All of us have written a manuscript from time to time that we thought was the greatest one ever written, and it wasn't. But with the help of the reviewers and the help of the editors telling you what you can do to improve your paper, and if you're persistent and you're willing to send it to a couple of journals, now you can't do that simultaneously, but if you want to send it to one journal and if they don't get accepted, go to another journal, ultimately your hard work should pay off and you should have a higher batting average of getting your papers accepted than otherwise. And I hope this sort of overview of the process and some tidbits that I learned along the way would be helpful for that. Writing a winner takes experience, time, effort, patience, and the help of others, but I believe it's worth doing. And I want to thank Professor Bashir again, Professor Namiri, and everybody else who was involved with inviting me to give this talk. Thank you very much.
Thank you very much, Professor Shikora, for this great comprehensive talk and full of guidelines. And we have panelists who have great experience in publishing. And let me start and hear your experience, Ali. On average, when you submit a paper, how many revisions do you have to go through before the paper gets accepted?
Yeah, at least one revision, sometime couple of revision. I rarely get the acceptance on the first shot. And I wanted to add a brief comment for the young author, young scientist, that don't be discouraged if you get the rejection, as Scott mentioned. So you can use the comments by the reviewers and improve your paper. and submit it to the other journal. I would say on average I get rejection once in a week or other week, but you feel bad when you get the rejection letter, but that's not the end of the world. You can improve your paper and submit it to the other journal. Sometimes I get rejection from a journal with impact factor of 5. I improve my paper based on the comments, and I send it to the other journal with higher impact factor, and it gets published. So yeah, in the beginning, in the first few years, when I was getting those rejection letter, I was thinking that was the end of the world, and that made my days bad for a few days. But now these days, that's okay. It's like every other email that I get, I try to use that and improve my paper, and then I submit it.
Now with that, let's hear from the audience. And we're going to launch the first poll. And in it, have you ever submitted a paper for publication before? Please take the time to answer it. It's a simple question, yes or no question. Meanwhile, I'm going to ask Dr. Mary, how many papers does it take before you actually feel comfortable with writing papers and the process of submission?
Thank you, Ahmed. I really can't decide on a number, but I think before you reach 10 papers, you're probably comfortable. But I think one of the things that can make you more comfortable is, for instance, getting involved in the review process. So being a reviewer for a journal is extremely helpful because you see how other people write and you see how papers start at the beginning. So I encourage all the young researchers, surgeons, and non-surgeons who are interested in publishing to actually be involved as reviewers for journals. That's one. The second thing is to work as a team and not as an individual. So if you have a research team made out of people with different experience, and then you actually work together to look at the study from the beginning, from the concept into publication, you tend to actually get good advice from different people. And then the final thing is, at the beginning when you start, if you don't have a research team with you, partner with someone even outside of your institution that can actually help you and guide you through the process. But I think by the time you get to 5, 6, 7 publications, you've gotten the idea. But the things that helps the most, in my opinion, is becoming a reviewer for a journal. That's usually very helpful, and that's not very difficult to actually do.
If I can add, I want to agree with everything Dr. Mary said. His advice is right on the money. We are always looking for good reviewers. Reviewers are like you and me. They're surgeons, they're nurses, dietitians who have volunteered. Some of them are quite good and some are not so good. And we try, because we do keep track of how our reviewers do, to remove the ones that just aren't qualified and to welcome more and more reviewers who are qualified. And particularly the young reviewers do a great job. Anybody listening who wants to be a reviewer, please just email me and I'll get you in the system. And the reviewers then get promoted, as some of the panelists have, to editor and then to associate editor, and they'll probably take my job pretty soon.
Great, thank you, Dr. Shakura. Actually, that was my next question, how to get involved in the review process. Dr. Alan Saber, you're in private practice. We're always talking about, publication is generally anyone who's working in academia, but how do you do it in private practice with an amazing number of publications?
Yeah, Ahmed, I'm in academia, and the way I do it, usually I have could be a question that I cannot find answer. I do a midline search to see if anybody publish something similar. If not, I write a protocol, I get the IRB, then I move forward. So you start with the idea, you do your homework, you do a PubMed to see if it's original idea or not. If it's original, you draft IRB, then you start to collect data, and you can actually start writing about the paper without getting all the data collected. You can have the title, introduction and material methods.
Great.
Ahmed, if I can make a comment,
Yes.
one of the other things you can do as a young researcher is to actually, at your institution, try to see if you can get on the IRB at your institution. That might be a very beneficial process. Usually it's not an onerous job, maybe 1 or 2 hours a month for the meeting, but you will actually learn a tremendous amount because the IRB is usually made out of a very diverse group. And if you can actually get on the IRB at your hospital, if your hospital is very big, it might be difficult. But if you're at a small institution, that would be a very beneficial thing as well.
Great. Let's just review the results of the first poll. And we have quite an audience who are actually interested in publishing. And hopefully we'll get the 33% of people to submit their experience as well. And with that, we'll launch the second poll and a follow-up for the 67% who actually submitted a paper. Have you ever been rejected? And please share your experience with us. And I'd like to ask Ali again. So how do you actually make it to the high impact journals like Annals of Surgery?
When you want to publish in high impact journal, you need to have all elements that Scott explained in a very strong way. So you need to have a very interesting topic, you need to have a good material, and you need to get a very significant result. So all these elements should be very strong in order to get published in a high impact journal. So the high impact journal usually don't publish the retrospective studies. So that probably means that you need to work on a prospective project and a clinical trial. So I think those are the elements that you need to do. But for the beginners, I think starting with the review articles or starting with a small retrospective studies which have some merit, value, new concept, that would be the good start.
Yeah, Ahmed, I want to add something about how to make your paper have a best chance for acceptance. As Scott mentioned, you write about meta-analysis, systematic review, and meta-analysis, especially meta-analysis of randomized controlled trial. You send your article in a high impact factor journal, as Ali said, Annals of Surgery. So you can publish as a team. Multi institution is better than single institution. Some journal also allow you to submit like a video to make your paper more known. Also adding more reference. It's very well known that more reference is translated to more citation. So many things they can do it to increase the chance for your paper to get accepted.
Great, thank you, Dr. Saber. And sharing the results, 75% of the participants actually said they were rejected in the past, which is, does it seem like a fair percentage of the overall experience?
As I mentioned, I get the rejection letter every week, every other week.
Yeah, we all have.
If you ask us, it's probably 100%, not 75.
I agree.
So, Dr. Shikora, so how do we actually, what's the secret for continuing to publish? Is there a team structure that you rely on to be able to continuously publish?
I think a team structure is very important, and I'm very impressed with Ali's program at Cleveland Clinic because they are very, very busy publishing papers. Ali is very, very well-written author, but they include their whole group on most of the papers. So they're all participating with each project, and I think that then develops more papers, and the people who are writing them are better at writing them. So they probably are having more success now than Ali may have had 2 or 3 years ago. But I think the team approach is very helpful. I'm trying to build more camaraderie at my institution because before I'd work on my project, my colleague would work on his project, and I'm trying to get us all to say, we got to work like the Cleveland Clinic. We all should be together on this. Everybody has something good to add to it, and that will improve our results here and more papers.
Now, Dr. Mary, you have a great team, and you're meeting every 1 to 2 months, and you can't get over the hurdle of things being left behind. How do you improve on the communication between the team and overcoming that, latency in having things done?
Sure. So I think the number one thing I would say from my past experience, when you assemble the team, you have to meet every week. Once you meet every month, you're already down the rabbit hole of getting problems. You have to be able to meet at least for an hour, 45 minutes, at least once a month. The team has to be diverse. It should not only contain surgeons, it should include residents, fellows, medical students if available, but also include non-surgeons. If you have someone, statisticians, researchers, if you also have physicians that can join the team. But the most important thing is when you meet weekly, you have a preset agenda. At the end of the meeting, someone is responsible for sending out the minutes of the meeting with clear action plan. Each project should have one responsible person that everybody else helps, but that person is the person driving the project. And meeting every week provides this ownership and responsibility where someone comes at the meeting and says, this is what happened with the project, this is what we did. And then people throughout the week actually work on the projects and come present what they did during the weekly research meeting. The second thing is you have to know all the meetings throughout the year you're going to submit abstracts to, and you know their deadlines ahead of time. And this way you could actually get in an organized fashion. But I think the most important thing is meeting regularly, at least once a week, having a diverse group of people, and then having an agenda for each meeting, a person for each project, and having minutes for each meeting with exactly what was discussed.
Great. And with that, we'll launch the third poll. And did the rejection make you stop from submitting the paper again? Which is something that we face. Dr. Saber, when do you actually stop and give up on the paper? Does it ever happen to you or not?
I think the key thing, never give up. So the worst scenario, you get rejection, which at the beginning, as Ali said, I used to be upset. I don't get upset anymore. So once you get rejection, as Scott mentioned, two types of rejection. Early rejection, you get it from big journal like Annals of Surgery, and usually happen within a week or so. This means could be something major with your article, or you just accepted or published something similar. So very important to do your homework, and before you submit to a certain journal, look at the last 2 years or so to see if this journal published something similar. Then after that, you get your rejection. You look at rejection as opportunity for improvement. Rejection doesn't mean the articles are done. You can fix the articles looking at the comment of the reviewer and send it somewhere else. Once you pass the initial phase of unhappiness, you sit down with your team, re-examine the articles, get a second opinion, get a senior partner or author that used to publish a lot, and look at details how you're gonna fix the article and do a major revision and submit it somewhere else. So my advice, just never, never, never give up. You have to
I
be
think
persistent.
what's also important is to understand that your paper may not be the best. It's the best paper out there, and to understand that the reviewers and the editors are probably correct when they want change. It's very easy to say the reviewer didn't understand my work, the reviewer was prejudiced against me, the journal doesn't like bariatric surgery. No, your paper needed work. That's all. And once you accept that, do the work, roll your sleeves up, do the work, and either resubmit it back to that journal as a revised, better paper or send it somewhere else.
Great. And with that, actually, that's the experience of the participants, and nobody got depressed. Everyone resubmitted their work, which is great. And, we'll launch the final poll. Did you revise the paper and then have it accepted for publication? And so what are the elements that can help you improve your paper and hopefully get over that rejection if you can't see anything wrong with the paper? Ali?
So I think we need to pay attention to the reviewer comments, and we need to follow the instruction by the editor. Most of the time, the editor or associate editor put a small comments on top of the reviewer comments. So we have to follow those suggestions and those comments and provide good answers for those. As the other panelists mentioned, it's always good to consult, to talk with the senior researchers in your team, in your hospital, have them read your paper and incorporate their suggestions. So it takes time. You can, most of the time, you cannot provide answers or revise paper in few days. It's going to take few weeks at least, or maybe months. But most of the time, you can provide a better paper.
And Dr. Mary, how do you approach a meeting presentation differently from writing a manuscript and submitting it to a journal?
No, it's actually the manuscript is the culmination of the work. So usually when we sit in the research meeting, we brainstorm about ideas. Then if an idea actually sticks, and just like Alan said, we look at the literature, it has not been published before. We work on the data to create an abstract for a surgical meeting or a medical meeting. And then from that abstract, once it's accepted, then we move on towards writing the manuscript. That's for the most part, with the exception of review articles. That's how the process we try to do. Most meetings, if your paper is accepted for an oral presentation, expect to get the manuscript before the meeting itself. So if there's a discussant of your paper, they can actually look at your manuscript.
Great, thank you, Dr. Mary. And the last poll, 72% actually got accepted, which is a great number. And my last probably question before we go to a question from the audience. The literature has a lot of papers. How can you find an interesting topic and within it avoid a bias that we always face, confirmation bias? We're always looking to find evidence in what we believe in. Dr. Shikora?
Well, I think for the first part of that, sometimes an interesting topic will find you. You're busy in the OR, you're busy in the clinics, and invariably some patient's going to come in with something you've not seen before, and someone's going to say to the senior member of the team, have you ever seen that before? And the member may say, no, that's really odd. Let's do a literature search. You do a literature search, you don't come up with much, and you say, we could study this. And that's how the project sort of gets up and started, literally from a seed. And I think the other way is just having conferences, having meetings, talking to people, other ideas will come into mind. It's just a matter of like writing music. You know, it comes into your head because you're around it so much, and you start thinking about it and saying, that's an interesting topic, and this is an interesting topic. So I'm not sure if anybody else has any different ideas about how you come up with topics, but like I said, sometimes they find you.
So the way that I come up with the topic, after the IFSO meeting or ASMBS meeting or SAGES meeting, when I get to the plane to come back to Cleveland, I go through the abstract book and screen the abstract book, the titles, and take a quick look to the one that would be interesting. And I put some notes on my cell phone. And when I get back here, I talk to my research team about those ideas. So that's the way that I get the ideas.
Dr. Salper?
And also sometimes you have a technical difficulty in the OR. So you did something happened in the OR, you say, you know, let me see what the other people are doing. Then you start to search and come up with the idea.
Great. And Dr. Mary?
So I'll just add one more thing. I think all the ideas are excellent, mentioned by Scott, Alan, and Ali. The one other thing is examine your daily practice and look at how many things you're doing that are evidence-based and how many things that are not evidence-based. The things that are not evidence-based that you're doing could be the things that you can actually look at and try to change.
Great, thank you. And with that, we have a question from Dr. Cameron Shaw from Sweden, and asking about long-term follow-up. How do you report long-term follow-up, and how do you report patients who are lost to follow-up in your paper?
Well, one thing that the instructions would tell you is that if you're going to include long-term follow-up, and you say that patients have been followed for 5 or 6 years, but you have those data points at 1 year, 2 year, 3 year, you need to include how many patients were still in the program or in the study at each point. So if you started with 100 patients at year 1, and in year 2, your results were 80% excess weight loss, you need to say how many patients were still at year 2. Maybe it's 85 patients out of the 100. And then so on and so forth, because what's important about that is that if you start out with 500 or 600 patients and your conclusion of your study is that at year 5 there was 80% excess weight loss, that procedure is very, very beneficial, but there was only 25 patients in the study at year 5, that basically tells the reader that this data is tainted. So that it's important to record at each year point how many patients are still in the project, in the study, or in the clinic.
Great. With that, any final comments, final remarks?
My final remark is don't give up. We heard that only 71% of people revised the papers and got it accepted. That should be 100%.
Great. Dr. Mary?
I think my final remark is get involved in the process of peer review, in the process of publishing your research. If you do something that's interesting, don't keep it to yourself. Share it with us. Let us know about it.
Dr. Aminian?
Doing research and publication are not easy job. It needs practice like everything else. There is a learning curve, and you need to get involved and keep doing that and keep practicing to get better.
Dr. Salper?
I think, as Scott mentioned, never give up, and people have to realize how important publication for your CV, for your academic career.
Great. I thank you all. We missed Dr. Pradeep Chobi, who couldn't be with us. I want to remind you that in 2 hours, Dr. Almino Ramos is going to be operating live on AIS channel. So please join that transmission, and hope to see you next time. Thank you, everyone. Thank you, Dr. Shakura and the panelists.
Thank you very much.
Thank you very much.
Thank you.